Hi, everybody. This is the Dr.Debunk weekly podcast show. On this show, I'm going to be debunking the medical myths, garbage, and crap that's spread by doctors and other health professionals. Dr. Debunk is the medical truth teller. Today's podcast is going to be about dementia, about Alzheimer's disease. Everybody's heard of that. Everybody's afraid of that. You should be afraid. Fear is a good thing when used correctly. It's one thing to have your body break down from disease. It's a whole other thing to have your brain break down. So I wanted to put in my 2 cents about Alzheimer's because over 33 years I've seen a lot of it and watched my patients disintegrate before my eyes, which is not happiness. So I'll just go over some basic points, facts about it. Just give you some of the medical background because it's dementia and Alzheimer's are, similar. Dementia would be the big term, and Alzheimer's is a particular form of dementia. You can look at it one way is that senile dementia or old age dementia, you could say everybody gets a little bit of it, whereas Alzheimer's is a specific way of losing your mind, basically. Alzheimer's, both you lose the connections between the brain cells, but also the brain cells are dying. And then kind of old age dementia, it's kind of more of losing the connections. So Alzheimer's has both components of losing short-term memories and long-term memories, whereas old age dementia would be more of just slower memory functions, more short-term stuff than advancing, depending on all the life factors. So, unfortunately, when we dive into this, the cause of dementia is really poorly understood. I think more can be inferred than what science says, at least my opinion, and I'm going to tell you about what I mean by that. But there's definitely a strong genetic component, that's for sure. But as I've talked about in my Genetic Talk podcast, genes are amplified or not amplified by lifestyle. And I think nothing could be more truer than in Alzheimer's. It's the life you live that really makes the big difference here, even though they debate on what's true about behavioral lifestyle factors and its effect on dementia. I think there's tremendous connection. So anyway, there's no specific way to stop the progression. Drugs don't stop it. Once you begin to get it, it just progresses at different rates depending on your lifestyle. And so, just to give you some basic stats, as of 2015, there were about 30 million people worldwide that were affected. So it's big. It usually starts at over 65 or more. They talk about pre-dementia, early dementia, moderate, advanced. I don't think we need to get into that. There's just specific signs and symptoms. At first it's kind of considered forgetfulness and it's not diagnosed. But over time it becomes apparent to usually family members first because of not only just short-term memory loss, but, events that are completely forgotten that the person will say that never happened. So as far as causative factors, we can get into some of that because it's good to understand it. Genetics plays a role. They have identified at least 20 genes right now. Probably, no, maybe 40. My information's at least 3 years old, so the rate of gene allele discovery, in other words, decoding the genes, is going so rapidly no one can keep up with it. But there's probably 30 to 40 genes that talk about your predisposition or resistance to getting Alzheimer's or some form of dementia. So it's a big deal. And as I mentioned in the other podcast, that everybody needs to get genetic testing at some point, but you want to do it privately, like I said, because it'll be really important to know which of these genes you have, because the knowledge can give you more motivation to not do the stupid things that I believe promote dementia. And so there's like 3 different parts of things that are happening to cause dementia. There are different scientific theories. I mean, one's called the amyloid hypothesis, and that just means there's this abnormal protein called amyloid that starts to collect, and it basically wrecks your brain. And that's all you need to know. The other one's called the tau hypothesis. And the tau hypothesis, it has to do with this protein called tau proteins. And this has been kind of made very famous or popularized by that movie Concussion, and the whole understanding about repetitive head contact with football players and how devastating it is. These tangly proteins strangle the brain cells and the nerve fibers. That's due to these tau proteins. And we see this not only in repetitive head trauma injuries, but it's part of dementia. It's part of Alzheimer's. And then there's like a biochemical hypotheses, which it just talks about that there's damages in basic biochemical functions, like how we use copper, iron, and zinc is seen. The metabolism of these minerals are screwed up in dementia. And there's other chemical processes that go haywire. And so those 3 are the main things that are going haywire, which for me, from a preventative health point of view, or from an optimal health point of view, there are things that are directly related to having not these 3 things happen. I don't know if I didn't say that correctly. These 3 things we don't want. We don't want amyloid proteins. We don't want the tau proteins that are like strangling you. And we don't want these biochemical abnormal reactions. And so there are life factors, like the one big one that we've seen in medicine that's huge is smoking. I mean, if you want to get dementia, just keep smoking. I mean, you always hear about the cancer and the emphysema and destroying your lungs. You're destroying your brain. And it's, to me, a huge factor. It's very clear. Which also means air pollution is another deal. But I don't know what you do about that. Hold your breath a long time? That's a joke. Anyway, there's another concept here that I think is really important, and that is the natural healing, regenerative processes of the body. Brain cells are very unique because they're the one cell in the human body that doesn't replicate. Normally, all the cells of our body regenerate. We basically make new cells. Basically, the cell divides, all the trash is segregated to one side of the cell, all the good stuff in the factory workers come to the other side, and we get rid of the trash and make a brand new cell. Well, you can't do that with your brain cells, because the brain cells have at least 100 nerve connections to them, and you couldn't separate the cell or you'd lose all the connections, which means you'd forget everything. We'd have to start over every time we made new brain cells. So we're stuck with our brain cells, and you want to keep as many as you can. Especially, I know some people that don't have too many brain cells, and they really need help. But other than those people, we need to keep all our brain cells healthy because they can't get rid of trash and do things that other cells do. And so that's a whole concept of how do you keep healthy brain cells, which we'll talk a little bit about. Okay, so basically, just to do a little bit of what we call the pathophysiology, or what goes wrong, is we are accumulating these bad amyloid proteins, and we're making these tau strangly proteins, and then the factory's going haywire, not fixing itself. And all of that progresses at various speeds due to your genetics, which is why it's going to be important someday to know all the genes that you have to promote or inhibit Alzheimer's. But it's mostly the bigger part is our lifestyle, and I'm big on that. But I want to highlight one point, and so let me just read you something right out of a medical textbook, which says various inflammatory processes and cytokines is just another name for interleukins and chemokines. I don't know why you have to name everything 3 ways in medicine, but cytokines, chemokines, and interleukins are kind of the same thing. But cytokines are the main chronic inflammatory stimulators. So various inflammatory cytokines play a role in the pathology or the formation of Alzheimer's disease. Inflammation is a general marker of tissue damage in all diseases, and it may be either secondary to tissue damage in Alzheimer's, or it may be a marker of an immunological response. There's increasing evidence of a strong interaction between the neurons and the abnormal inflammation mechanisms in the brain. Obesity and systemic inflammation may interfere with these immune processes, and it promotes the disease progression. And all of that's a fancy way of saying that chronic inflammation is the worst enemy of your brain. Because we can't make new brain cells, inflammation can cause the most destructive changes and accelerate the progression of Alzheimer's, either your susceptibility to get it or advancing it if you do. And I'll get to that in a minute about why chronic inflammation needs to be controlled at all costs. Okay. So there's different ways we diagnose it and the criteria and all this hoo-hoo medical stuff that you really don't need to know about. I think what we'll just get to is the stuff that we can do and not do. And so let's talk about the stuff that I don't think you should do. And that is buy into using drugs as preventative tools. That's a concept that's growing in medicine that I heartily disagree with. And they're trying to do that with everything. That somehow everybody should take a little bit of blood pressure medicines and cholesterol lowering medicines and other drugs that we doctors want to believe will help prevent you from getting a disease, but really they're talking in code. What it really means is that taking low-dose blood pressure pills, like everybody, whether you're sick or not, and cholesterol pills, that's a big one they're trying to start pushing, that everybody should take 5 years of cholesterol-lowering drugs somewhere in their adult life. That will prevent diseases, but what it really means is it will delay the onset a little longer. And they're hoping that. There's no real evidence to show that. And so here, let me read something else to you right out of a medical textbook, or really out of a paper. Long-term usage of non-steroidal anti-inflammatory drugs, things like Advil and Aleve, NSAIDs, back in 2007, they thought these were associated with reducing the likelihood of developing Alzheimer's. I mean, evidence suggested that the notion that NSAIDs could reduce inflammation related to these amyloid plaques, but what happened in the end, the trials were suspended due to high adverse events. So in other words, they were doing just that, giving people non-steroidals every day to try to combat the inflammation, because that we knew and we can see that it's very much related to forming the amyloid and the tau plaques and tau tangles. The problem with that movie is non-steroidals, Advil and Aleve and all the other fancy prescription ones, which are all kind of the same really, they affect acute inflammation, not chronic. Well, the formation of dementia through these plaques, amyloid and the taus, that's a chronic inflammatory thing, and these medicines are going to do nothing to stop that. And so they stopped doing the trial. But it's still pervasive in medicine, the idea that you can do this. So you should be very suspicious of doctors without some really good long-term studies, which have not been done, showing that this could help. And the other hokey thing is that there's a belief in medicine, and I haven't found the studies, I don't even know where it comes from, that hormone replacement therapy in menopause, women taking estrogen and progesterone, might increase the risk of dementia. I think that's just absurd to say you maintain optimal hormone levels. I mean, I'm a big hormone replacer, and there's nothing but good news from taking hormones in the correct dosages, because almost nobody, if they live long enough, is going to make optimal levels of hormones. And anybody who does a lot of hormone replacement over their career sees huge benefits. So anyway, that's something not to buy into, the classical medicine use of drugs or trashing hormones as a way to prevent this. So let's get to, let's do a little break, and then we'll come back and get to the good things that you can do and why. Hi everybody, Dr. Debunk here, and I bet you think this is going to be a commercial about KSK Cold Spray. But you're wrong, because if you've been listening to my podcast, then you know I've been pushing my spray. But the flu season's over, and so I wanted to mention to you something that some of you know I do, but that is about weight loss and weight maintenance, or controlling your weight, the whole subject of weight. I've mentioned it in some of my podcasts, giving little bits of information. But I have been studying weight and helping my patients lose and then maintain weight for 11 years. And this program I've developed with much trial and suffering is now capable of getting 30 to 50 pounds off just about anybody in 3 to 4 months. You heard it right, 30 to 50 pounds, 3 or 4 months. And so what you should do is, just to get some information, so what you should do is go to Dr. Debunk website. That's drdebunk.com. If you haven't been there, there's videos and some information. But I have a little introductory video there about weight, how it works, why we are so fat in America, why it's so difficult. It's about 30 minutes, and if you watch it, you'll get it. You'll get what I do, what I can do for you, and how the program works. So that's it. I'm Dr. Debunk, the medical truth teller. Okay, welcome back. So I want to move on and just talk briefly about the things that I believe are beneficial. I believe through my 33 years of watching this disease can have benefit. Not curative. Once it starts, we can't really seem to stop it. But the speed of progression, I think, can be modified dramatically. Lifestyle activities, the standard lines, the standard medical stuff is, which I agree with, things like people that with dementia need to read, actually playing board games, crossword puzzles, things that require your brain to work, and especially good social interactions. All of these things reduce the risk or the advancement, slow it down. I mean, there's a whole bunch of psychological theories about doing this stuff. I don't really need to get into that. I'll get to what I think is important myself. Diet is something important to talk about. There's a lot of debate about diet. There seems to be a connection of people that have like a Japanese or Mediterranean style diet have reduced risk of getting it and helping it. And basically, they debate how much help it really has, but I think it's tremendous. I think that the closer you are, diet's simple to me in dementia. It's the same diet for all of conditions of what's an optimal health diet, what's the best way to eat, and that's close to a vegetarian style diet. I mean, and probably for dementia, the best thing would be to be a pure vegetarian, and all that entails. I won't go into that detail. As far as supplements, I'll get to that in a second. So let me jump, though. You know what I forgot? Let me put it in here right now. Medications, because obviously doctors like to push drugs. And there's 5 or 6 or 7 dementia drugs. Now, you got to understand what they do, even if the doctor doesn't tell you. No medicine will stop the progression or cure dementia. And whether it even slows it down is debatable. What it does do is give people a higher level of functioning. It can. But if they're going to go from minimal dementia to severe dementia over 4 years, it really doesn't slow that down at all. They just would have a higher level of functioning during those 4 years. And there is a concept that it may actually speed up the progression of the disease. So that would give you better quality of life, but you might become advanced quicker. I'm not saying that's true. I definitely watch that with certain patients. I don't know what it means, but... So I'm not real big on the meds. I'm big on lifestyle stuff. Just really, if you're taking care of somebody or going to be taking care of your parents, you really need to look into the meds in great detail to decide if you want to go down that road. But anyway, back to what I think is beneficial. Let me get to the last part here, because I think there are things that you can do. And that is chronic inflammation, without a doubt, is the main accelerating factor in dementia, any brain condition. And there's two very powerful tools naturally to reduce chronic inflammation, and that's the resveratrol therapy, which I've talked about, and you'll have to look at that podcast, or if we didn't do a podcast yet, it's on the Dr.Debunk website, and you can... oh, no, we did. We did a podcast on it. You can find the resveratrol podcast and listen to those. I think it's a 2-part or 3-part series. And then omega-3, I haven't really done a podcast yet, but the omega-3 therapy, which is fish oil stuff you hear all about, that's a whole topic in itself. But omega-3s in high doses, higher than dietary doses, reduce inflammation differently than the way resveratrol does. And anybody that's dealing with dementia, they need to be on both of these. Now, it's a problem because they're both laxatives, so you have to figure that out, but you can get the podcast information on how to do it. But those are huge. There is no doubt that these things will delay the onset, I believe even prevent people from getting it, depending on other life factors. And down the road, I'll do a detailed discussion about this and how to take it. But it's just introduction to the concept. You can do digging yourself and find a lot of information out there. But, taking, 1,000 milligrams a day of resveratrol, 500 twice a day, would be great. And then also taking 1 or 2 tablespoons a day of flaxseed oil, which I think is the most inexpensive and effective way to get omega-3s. So resveratrol and flaxseed oil, just like that. Awesome. And this is based on science. There is the evidence of how these work to reduce inflammation is, undeniable, incontroversial. It's just, there's plenty of science. And so then as far as a preventative tool, if you had like genetic profiling done or it's in your family and you realize, wow, I'm at high risk, then your entire life, you need to do hard cardio. You need to be a cardiomaniac. You need to do hard cardio your entire life because circulation, as I've talked about in a podcast, the circulatory theory of aging, is everything. And the more blood you pump to your brain, the more normal it's going to be. So as a preventative tool, it's just critical. And the other thing is that goes with it, the opposite is sleep. Do not be a sleep cheater. If you identify in your family, that Alzheimer's or any kind of dementia runs in it, and your family, and then you get some genetic markers done down the road, and you have more of the promoters, boy, you got to sleep. Don't be a cheater. Don't be like me. The first 55 years of my life, I was the biggest cheater. I mean, if you looked in the dictionary under the word sleep cheater, my picture was there because I didn't ever needed to sleep. But I've paid a price since I was 55, and just now in the last 2 years am I starting to be able to get good sleep because I never needed it, but not a good thing. And then probably the final thing is learning how to minimize exposure to pollutants. It's a big deal. And it's a very long discussion about pollution in all its forms. But I just want to mention this. Because, again, the brain cells can't replicate, because they just sit there, if our body can't get rid of metabolic waste products, pollutants, chemicals, byproducts, poisons, toxins, heavy metals, all the junk that modern society is giving us, the body has to get rid of these things. And when it can't, it sticks it in cells of our body that have a low turnover rate, like fat cells will store pollutants. But the biggest stores of all, I mean, if you want to tuck away something that you need to get rid of, where would you stick it? In brain cells, because they never turn over. So you could tuck it away in the corner of a brain cell, like heavy metals or like aluminum, which they see that sometimes. You see I think it's less than 1%, but they will find 1% of Alzheimer's patients that have a lot of aluminum stuck in their brain. The body is trying to get rid of them because aluminum's toxic. We don't use aluminum as a mineral in our body. So the more you have in your body, the more poison it is. And we find this, and we don't know why these people stick it there, but it's a statistically observable phenomenon. So minimizing pollution, exposure to bad junk, which I will talk about in great depth in another podcast. But these three things, resveratrol, omega-3s, hard cardio, sleep, and minimizing pollutants, I think the evidence, the circumstantial evidence is overwhelming that these things will prevent it from occurring, minimize the speed of advancement, and give your relative that you may be taking care of a better quality of life if they do these things. And then finally get back to the diet thing. With age, diet becomes more important. When we're younger, when we're under 50, you can eat dirt, and it doesn't matter as much. But over 50, dietary changes can have a profound effect on any conditions, and definitely mental conditions. So that's pretty much it. That is a little overview of the natural things I think that can be done to affect the outcome of getting dementia or Alzheimer's. I'm Dr. Debunk, debunking medical myths, garbage, and crap spread by doctors and other health professionals. Thanks for listening.